Good evening, everyone. Good evening, So, shall we start the session?
Good evening, sorry, good morning, wherever you are. My name is Fathy Elshazly. I'm ICU registrar at the moment in UK. Of course, in Egypt, I'm an ICU consultant, and currently I'm in a training program, and I'm delighted to share this session with you, which is going to be clinical case scenario. I'm not sure if all of you know or not the system of the EDIC exam. The EDIC exam consists of 2 days exam. The first day is case-based scenario, in which there will be 3 stations. The first one station is for biochemistry, where you are going to face a lot of blood gases and some lab investigations, and you will be required to interpret those investigations and tell the examiners what are you going to do with those patients, whether the next investigation or the management and treatment. The second station is going to be about radiological images, whether ultrasound, X-rays, CT, MRIs, and you're required to mention the diagnosis to the examiners and to the management as well, if required. And the third one will be curves. It's going to be either ventilator curves, arterial line curves, pulmonary artery catheter curves, ECGs, and the same. We are going to interpret those curves and tell the examiners, if required, what are the lines of management or the next step in management of those patients. The second day is going to be what's called CCS, or clinical case scenarios. It's going to be about 3 stations. The first station are going to be 2 short cases. Every case is about 20 minutes. They're going to take it from the start with a patient, for example, infective endocarditis, what they're going to do with this patient, when they are going to admit them to the intensive care, what is the lines, how are going to manage them, and whom you are going to call or consult about their management, when are you going to discharge them. If the patient deteriorates, it's not because of you, this is because of the scenario usually. What are you going to do next? Whether how you are going to communicate the decision to the family? Are you going to withdraw? Are you going to issue do not resuscitate order? Are you going to contact the organ donation team? And how we are going to approach the family to communicate with those kind of decisions. And then there will be 2 long cases. Every long case is about 40 minutes. And the same, they are going to take you into a journey from the point of admission to the intensive care, or even before admission to the intensive care, when you first feed the patient in the emergency department or on the ward, and how we are going to manage the patient till they being admitted to the intensive care, and then after the intensive care till they are being discharged, and what is the plan after discharge from the intensive care, whether how we are going to follow them up on the ward, or how we are going to follow them up after they are being discharged home, even through the post-ICU outpatient clinic, for example. Which is easier. Clinical case scenarios I can say that it's usually easier for most of us, especially those who have spent some time in the intensive care, or a lot of years in the intensive care, because it's usually what we do every day. They are going to take you into a journey, and they are going to just ask you what you are going to do with those patients. And most of us usually pass the clinical case scenario. You are allowed to fail only 1 station in every day. For example, you are allowed to fail 1 station on the first day, clinical based scenario case. For example, you are going to allow for example, to fail the curves. But if you pass the other 2 stations, and then on the next day, you are allowed to, for example, to fail in 1 case, in 1 long case, for example, or you can even fail in the 2 short cases, because the 2 short cases are considered 1 station. And if you fail on only 1 station every day, you can still pass the exam. For example, if you fail the curves station, and then you fail the 2 short cases station, but you pass the other 2 long cases station, and you pass the other 2 stations of the CBS on the first day, you can still pass the exam. But hopefully you will pass all the stations. without failing. Today's session is going to be a long case, long respiratory case. I tried to summarize it as much as I can. I hope that we can finish in only 1 hour. It will be depends on you how you are going to participate and how we are going to go along with the case. My only request that without your participation, this session is useless actually, because I'm not going to explain or anything to you. I'm going just to take you through the case, and
All
then
that,
we're hello.
all the friends, this is going to be a very interactive session. Also, sir, today
Yes.
was the
Yes.
result of EDIC Part 2 aspirants.
Mm.
We have received a lot of successful stories. Like they have passed
Exactly.
the
The
exam
results were
in the first attempt. Some have passed in the second attempt. Well, it's all fine, but it's a huge success for Farz Academy.
yes,
And so
exactly.
thanks to you. Many aspirants of our asked to thank you for the contribution you have.
Exactly. Actually, it was good news that I woke up in the morning that a lot of aspirants or who passed the exam today, because the results were just released today, and it was really made my day actually, that a lot of our aspirants and have sent me messages thanking us for the passing the exam, and hopefully that maybe you as well will let me know after a few months from now that you passed the exam as well. Hopefully we can start now, and as mentioned by Fatma, that should be very interactive session. You should participate actually. You should answer. You should.
On the
Hello?
mics or the cameras also.
Sorry, yes.
Before we start,
Yes.
so aspirants, the topic for today
If
is
you can open your cameras, it will be great. But if not, at least you can open your mics and hands up if you want to.
participate in
Uh,
the class.
yes,
Yes.
if you want to
So
answer any
today's
of
topic
questions.
is respiratory CCS session, and it will be taken by Fathy Elshazly, sir. He's a great teacher, by the way. Sir,
Oh,
over
thank
to
you.
you.
Thank you so much.